So this is just a bit of a recap then about what is the menopause. So what we spoke about in the previous sessions is just a bit of an overview now for you. So the menopause is the ending of fertility and the ending of the menstrual cycle. So when we get a change in our hormone levels, our ovaries stop producing the amount of hormones that they should have been producing, which then leads our menstrual cycles to become irregular or to stop altogether. And the symptoms that we develop during the menopause are deficiency symptoms. So we become deficient in the hormones because the ovaries are no longer producing those hormones. And that produces the physical effects that we'll be discussing next month, and the psychological effects, which is what we're talking about this month and today. So really, when does the menopause start? Well, the menopause can start really from any age, but the menopause itself, you've got the menopausal symptoms, but the menopause is identified as the first day of your very last period. That is the day that you enter the menopause. Menopausal symptoms, perimenopausal symptoms, they can start from any time from like your late 30s, from your early 40s onwards, and then people can still have symptoms of hormonal deficiency all the way through being postmenopausal, so they have no periods, right through to maybe in their 60s, 70s, 80s, even 90s. We're all different. And hormone replacement therapy is about giving you back the hormones that you are deficient in to help reduce the symptoms that you're experiencing and improve your overall health. Thank you. So this is a really important part of menopause, and something really that I wanted to discuss as a separate thing, because the psychological effects, the psychological effects of menopause are extremely significant. I do consultations on women all over the UK, online and also in clinics as well. And it's the psychological effects of the menopause that really, really impact on women. Because the physical symptoms, you know, somebody's having a hot flush, you can see that. You know, if someone's having a panic attack, again, you can see that as well. But the psychological symptom of sort of like anxiety and worry and desperation can go unnoticed. And as women, you know, it's just, I'm generalizing here, but as women, we're very good at just getting on with things. And so we try to put a brave face on it and just knuckle down and think, well, I'm just going to get on with feeling dreadful and not coping particularly well. And you know, in my experience, the physical symptoms are easier to see, but the psychological symptoms are impacting on women even more, and it affects all aspects of your health as well. And I think the one thing I wanted to talk about really is, has COVID helped or hindered this? Because some of the main experiences I've had with women with their menopausal symptoms is the fact that being in lockdown has actually helped them with their feeling of wanting to stay away from people, wanting to be isolated. So COVID and going into lockdown and not socialising has helped more of them than not. So again, I'll be interested later on. We can have a bit more of a discussion about this and certainly get some of your views and opinions about it. But the psychological aspects of menopause, they actually filter through to all aspects of your life. Thank you. So what are the emotional effects? Well, they're the increased anxiety. This sort of like comes from nowhere. Women can feel quite normal about things, and then suddenly they just start to feel that horrible butterfly and knife twisting in the pit of your stomach kind of feeling for no reason whatsoever. And it's the way you describe it, really. It's a bit like going for an interview or just about to walk in through the door of an interview. That heightened anxiety feeling that you've got will be like that for the majority of the time. Reduced confidence. So things that you would normally be very, very good at and very, very competent at doing, your job, managing the household, driving, etc. Women have said to me that they literally, they've forgotten how to drive. They don't know how to do their job. They just feel that they can't do their work anymore. And a lot of that, really, the increased anxiety and reduced confidence will go hand in hand with things like brain fog. So if you can't remember things, that will increase your anxiety, reduce your confidence and your ability to do your job or be the person you are managing the household, and doing all the daily activities that we would normally do. So a low mood and a flat mood, because women often say to me that they don't feel depressed. In fact, it's a very common thing. They don't feel depressed. This is a completely different thing. They just don't feel a great deal of anything. It's sort of like, and it's an emptiness, a shallowness. The way I describe it, it's a lack of joy, and people feel low in mood, and they just don't want to do anything. And again, the reduced confidence, the increased anxiety, all these various aspects just contribute to this feeling. So often when we go to their GP at this point, because their mood is low, but they're not experiencing depression necessarily, they just know that their mood is altered because of the menopause, and they don't really understand how or why to make things feel better again. Women can develop mood swings and develop irritability, and that feeling that you just can't cope with anything. And again, it's that feeling that you're at work and you can't cope with the amount of work that's going on. You can't deal with relationships in the workplace as well as you used to. Maybe people are sort of like, winding you up a bit more. They're annoying you more when you think, well, I've worked with this person for a long time, but so why suddenly is this person just sort of like grating on me? Why don't I have the patience that I had before? And it's this kind of like inner turmoil that we have, and this feeling that you just can't cope, and you're literally hanging on to work, and you feel that your existence a lot of the time by your fingernails, because you're desperately holding on to being the person that you were and keeping everything going. And that's that spinning plates. We're very good at spinning all those plates and keeping them spinning all of the time. And what women are discussing with me is the fact that they know that the plates are about to fall, and in some people, unfortunately, they have fallen off. And it's a case of just being aware of what the menopausal symptoms can be like, and how these emotional effects can take hold gradually, and then just can quite consuming. Often women are pushing people away, so that's loved ones, family, close friends, and it's very much a time of feeling quite isolated and alone. And this is what I was saying about the COVID being wanting to push people away. If with the menopausal symptoms, if you're being locked away and you're told that you can't go out and socialise with people, has that helped your mental health or has it hindered it? Because it's quite mixed what I've got with people there. So because pushing people away is a common symptom, you just want to be left alone. You want to just push everybody away from you because you know that you're not feeling right yourself, but you can't quite put your finger on it. And as I said there, that horrible feeling, what is wrong with me? You don't really know. You don't understand it. It's just this kind of sick, empty, hollow feeling, but you don't know how to fix it. You don't know how to get rid of that. And then it's like, where have I gone to? Where have I become? Now, related to this slide here, yesterday I was thinking a lot more about this because I do consultations every day with people. And so I'm discussing the psychological effects with people. And I started to write down some of the terms that people, the kind of things that people say to me. So going on from this slide here, these are some of the words. This is how people feel during the menopause. And it's helplessness, anxiety, reduced confidence, lack of control. And this is a real big thing with menopause. It's a distinct lack of control. The way I describe it is the fact that because your menopausal symptoms are kicking in, because your hormones are going down and down and down, it's like these films where you're being dragged behind a car and you're lying there on the road being dragged along the road, and you're at the mercy of everything else around you. You have absolutely zero control of things, and that is how women are saying it makes them feel. often women telling me that they feel invisible. I've had ladies saying to me time and time again that, you know, I'm here, I'm functioning, I'm doing the washing and the cleaning, I'm making polite conversation with my family, but I might as well just not be here. And I don't mean that in a suicidal way. I just mean the fact that they just feel, what's the point of me being here? I'm not contributing to anything. I feel invisible because I feel worthless. And then women are saying that they feel that they're losing their mind. They're feeling so forgetful. They just feel that I'm losing control of my mind, and I don't know where this is going to lead, and that causes even more anxiety. It's a feeling of sort of like hopelessness, and this will never ever end. This is the way it's going to be for the rest of my life. And is this what my life has now become? I can't see any ending to this. And other women tell me that my personality has just melted away. They feel great sadness. They feel rage. They feel crying at times as well. And of course, you know, people can just feel that everybody is annoying them. And that's because of the mood swings as well. So all this is like feeding into some of the emotional effects there. Thank you. So again, it's this feeling about what has happened to me. And it's the feeling that you just want to hide away from everybody. You can't quite put your finger on the cause of it. But I've often joked with women to say that you would much rather just sit all by yourself and eat ice cream. And lots of people completely relate to that, particularly in this weather at the moment. But it's that feeling that you just want to shut yourself away from everybody, your friends, you want to pull away from them, and you just want to be all by yourself. That's the majority of women, but we all feel differently. All we can say is that we know it impacts on our psychological well-being. And women say that I just don't know how I feel. I just don't feel right. I can't quite put my finger on it, but I'm just out of sorts. I'm not there. I'm not the person I was, but I don't really know what it is. And when I explain about this sort of like joylessness, this flatness, this hollowness, most women can relate to that. And this is when most women go and see their GP and discuss their symptoms of menopause. But often they don't get the help from the health professionals that they want. I do have lots of women explain to me to say that health professionals and family members have said, you know, there's nothing wrong with you. It's all in your head. You're making it up. You're just avoiding situations. You're avoiding your work. You're avoiding your relationships at home because you're making it all up. And so what's really important is that we get the message across that this isn't that we're making this up. This is that the fact the hormones are controlling us, or the lack of hormones are making us feel and act in the way that we do. And it's not us. We have very little control over how we feel about things. But like I said, we just don't understand why we feel and why we think in this way, because the loneliness and the isolation that comes on with this. We feel that nobody else is experiencing this because women rarely talk about it. And that's why these presentations today are so good, and to talk about, you know, how menopause can actually make you feel. And it's the fact that, you know, with lockdown, they said this is the other side of it, is the fact that we're not mixing with our girlfriends, we're not going out, we're not having the casual chats over coffee and cake. We're not doing that anymore. It's harder to talk to people and really get your feelings out there and be true to yourself, because as we know that when you talk to people that understand you and people that are close to you, like your close friends, is the fact that they can see changes in you, and they've generally got some really good understanding and suggestions to what you should be thinking and doing. Because we've been locked away and we haven't been socializing as much, that might be harder for people. And then, of course, as we get older, that loneliness can increase as well, because we may be, you know, we're not going out, we're not mixing with people as we have been as we're getting older. And then obviously with the way things is with life at the moment as well. I find with my experience is that people from certain ethnic minorities do find it harder to talk. I've worked for many years in Birmingham city centre, looking after people. And I've seen lots of women with menopausal symptoms, that don't talk to members of their family, don't talk to friends, because it's not part of their culture, it's not what's done, it's not what's expected. And also there's very little understanding and literature and discussion around menopause. It's a taboo subject generally, but certain ethnic minorities may find this even more taboo than others. And certainly talking about women's problems isn't something that would ever be discussed openly with anybody in the family or with friends. So you can see how isolated some individuals would be from that. And that's why they withdraw from their friends and withdraw from social events as well. So I think if you can think about your friends and your close family that you think that you've noticed changes in them, that they are a bit more isolated, they are pushing people away, they are making excuses. I suppose the big question is, why are they making excuses that they don't want to see you, or they're leaving early? And really being a friend, it's just maybe to ask those more personal, difficult questions, because as we've said before, every woman will go through the menopause, and so it's important that we talk about it and we understand and can identify the symptoms that we're describing and feeling are menopause related. And then it's obviously about, being open with yourself. But it's hard when you're stuck in this situation, when you're feeling low, and particularly if you've been to see your GP and the doctor says that you're not going through the menopause when you think you probably are, or nobody tells you what's actually wrong with you, or you have a blood test that says that you're not menopausal, but you're thinking, well, if I'm not going through the menopause, so why am I feeling like this? You just feel that nobody understands you and nobody's willing to give you the time. And I'm sure quite a lot of people will be able to relate to that. Next slide, please. So I just wanted to give some facts really about the menopause, because I've just said in the previous slide about you go to see the GP, you have some blood tests taken to check whether you're menopausal or not. Well, NICE guidelines are very clear with blood testing in menopause, and they say that we spend about £9 million a year on inappropriate blood tests for hormone levels, because women under the age of 45, then blood tests can be helpful, not for everybody, and they're certainly not the be all and end all, but it is there in the NICE guidelines that they can be beneficial to people. But anybody over the age of 45, they don't need a blood test to diagnose menopause. Menopause is based on symptoms and your age. You need to look at the person. You need to look at that person's symptoms. But if they're younger, then blood tests can help. But if you're 44 having blood tests and you're clearly symptomatic of menopause, those blood tests can be inaccurate. And then it's that feeling that, well, is it all in my head? And you would take it quite personally that the doctor's done some blood tests and he said there's nothing wrong with me. So where do I go from here? So and because blood tests are done inappropriately and they can be the results can be misleading, then where does it go from there? Women are then left, walk out of the doctor's surgery and think, well, my blood tests are normal, so what does that mean to me? I'm still feeling low. I'm still feeling really low in mood. I'm not feeling myself at all. So where does this leave me? And often women are often offered where you can have antidepressants if that's the case. But women are prescribed antidepressants an awful lot for menopausal symptoms. But antidepressants aren't the first line treatment, because if people can have hormone replacement therapy, then that is the first line treatment for it. And so these women are often dismissed by the doctors. Some women just take their antidepressants because the doctor's prescribed it to them and they're not offered HRT. Some women are prescribed antidepressants and they need them, and some women need to take them for the rest of their lives, as well as having hormone replacement therapy. But some women that are just left from their doctors or health professionals, or even the gynecologists, and say, well, all your bloods are normal, so therefore, it's not menopause. But of course, menopause affects every woman, and just because the bloods aren't indicating that you're menopausal, that's not accurate reading in itself. It's about looking at the person and acknowledging that that person is experiencing menopausal symptoms and listening to people, because the suicidal rates amongst menopausal women is high. And the worrying thing about this is, if you look at the statistics of women that commit suicide, the highest rate are women in their 50s. And it's very, very, very frightening to think that if this is due to menopause, which I think it most likely is, or the underdiagnosis of menopause due to these psychological factors that we've been talking about today, then as a health professional, it is our right that we need to support more women. And we're not saying that it's all in your head. We're not dismissing people. We're saying, right, you're most likely menopausal. Let's talk about options for supporting you during your menopausal symptoms. Because they think then that the rates of suicide are highest due to the mental illness that can occur, either just generally or the mental illness effects that you get from the menopause. As we're getting older, our physical health is deteriorating, and due to social factors as well. Now, I can't see the bottom part. Can somebody just read that out, the last one, to me? Do women